Pain management after surgery usually consists of medications. Most patients are asked to try medications like Advil, Motrin, and Tylenol, which will very often cover their pain. Patients who do have more severe pain, which is unusual and unlikely, will be given stronger pain medications, which they will have available for them at home in that scenario. All patients are asked to use an ice pack, which helps significantly with the pain. In order to reduce swelling after the operation, we ask that all patients use a scrotal supporter or tight underwear to keep the scrotum and the penis elevated over the first couple of weeks after surgery. For the first 2 to 3 days, we ask you to also leave an ice pack on the area to help prevent some of the swelling. Care for the incision site is usually relatively straightforward. Most patients will have about a 1 inch to a 1.5 inch incision just above the penis, which is covered with Dermabond, which is a form of skin glue. Sutures are all internal to this Dermabond. You may shower as needed. We ask that you don't scrub over the incision site, but just let soap and water fall over the area and then pat dry after the shower. I advise my patients to start pulling down on the pump into the scrotum within a few days after operation. The best way to avoid constipation from the pain medications is to avoid the use of opiates. Most patients will find that with the use of Advil, Motrin, and Tylenol, that their pain will be well controlled and they will not require the stronger pain medications. In those patients who do require the stronger pain medications, we ask you to begin a bowel regimen, which consists of using Colace 2 to 3 times a day. In addition, I ask you to increase your fluid intake and to have a high fiber intake. I ask all my patients to avoid heavy lifting or otherwise strenuous activity for about a month after surgery. Most patients may resume showers within a day or 2 after the operation. Try to avoid tub baths for about a month. Driving after the operation is usually dependent on whether or not that patient is using narcotic pain medication. Patients who do require stronger pain medications are advised very strongly to avoid driving while on those medications. Otherwise, for the vast majority of patients, they're able to resume driving within a few days after the operation. With regard to return to work, it will often depend on what type of work you do. Office or desk work, most patients can return to within 3 to 4 days after the surgery. Patients who do more heavy lifting or more strenuous activity may need about a month off after the operation. The typical period to full recovery after this operation is a couple of weeks. Immediately after the operation, patients will be in the recovery room usually for around 2 to 3 hours before going home. The main changes that you should call me about are an increase in pain over time. In addition, if you start noticing redness from the incision, any drainage coming from the incision itself, or if there are any fevers, we ask that you call us right away. After the surgery, I usually ask to see patients the following day to assess the incision itself and to assess for removal of a drain that we will often leave during the operation itself. Thereafter, I will usually see most patients at 2 weeks. You can begin using the device as soon as your pain is under control and you're feeling comfortable to use the device. Most patients will begin using this at around 2 to 4 weeks. Any questions that come up during recovery should be forwarded directly to our office so that we can help you through this process.